Good morning. My name is Dr. Manjushree Naik. I'm a senior consultant plastic and cosmetic surgeon working out of Apollo Cosmetic Clinics, Apollo Spectra Hospital. This is in MRC Nagar, Chennai. And the topic that I have chosen to talk on today is the cosmetic surgeries of the female breast. Ever since we came out with the topic on social media, we found we were pleasantly surprised that there were a lot of questions coming in. So what I have decided is I will divide my talk into two parts. In the first part, I will just talk very generally and give you an overview of the surgeries that we conduct on female breasts for cosmesis. And in the second part of the talk, my secretary will then give me the questions which have come in and we will answer those. And for those of you who would like to type in your questions, please feel free to let it come in. You can type it in the comment section of our FB page, or you may call these numbers, the number that we have over here on the screen, and you can always get your clarifications in. We are here willing to clarify with you. You can fix up your consultations with us. Online consultations are also available. So please feel free to get in touch with us. So now let me get back onto the topic. Now the topic, as I have said, is the cosmetic surgeries of the female breast. So the clarification that I would like to make at the very outset is that I am not going to be talking about the non-surgical procedures that we do on the female breast. I'm not going to be talking about the non-interventional. It is only going to be the surgical procedures. And I am going to be talking only about the surgeries that we do for improving the cosmesis, not for reconstruction that we do for breast cancers or for trauma. So I'm going to limit myself only to the surgical procedures on the female breast which we do to improve the aesthetics or the appearance of the breast. So the first surgery that we do to make the breasts look bigger is what's called the breast augmentation surgery. It is for enhancing of the breasts. Some women with small breasts are very conscious about it. They have been subject to bullying, or they themselves feel very shy about the size of their breasts. So they come in to us wanting an augmentation of the breasts done. Now there are two techniques that we do usually. The gold standard, of course, is the implant, the silicone implant. So the silicone implant has been around for almost a century now. And there is more and more research and there are more technical advancements in the silicone implant that we are using today as we were using even maybe 10 years ago. So it first started off with being a saline implant, which means basically the silicone shell, and there would be saline filled inside. Now because of problems with that, slowly that moved to having a silicone inner, which was a little more fluid, and that then moves with a silicone shell. Now what happens when there is a fluid silicone that is inside, it tends to leak after rupture, and there has been silicone found in the tissues which create problems. So we have now moved on to the next advancement, which is a more cohesive gel inside the implant. So the cohesive gel means it's almost a semi-solid to a solid implant, which is then inserted into the woman. Now, how do we decide on what the size is when a woman comes into us, then we usually discuss it with her, what exactly her expectations are. Measurements are taken of what we call the base diameter, and then the decision is taken as to what kind of implant. We usually have sizers here in our Apollo Cosmetic Clinic, and we let the woman wear it and try it on, so we have an idea of what kind of size they are looking for. Because in cosmetic surgery, the main thing is that the patient comes in with some expectations, and that is what we need to fulfill. It is what they are asking for, not what we think that they need. That is the dictum in any cosmetic surgery. So once this is decided, then we decide on the size of the implant accordingly and how it is then after that done. So I will just show you, this is what an implant looks like today. And as you can see over here, in spite of the fingers being in, it's not looking like it's rippling because there is no fluid inside it. It is the almost semi-solid to solid cohesive gel inside. So even though it is being pressed upon, it remains firm, but it remains extremely soft. So the feeling post surgery on a woman with an implant is almost like a natural breast. It gives an extremely good feeling. So this is how we actually go in and do the surgery. There are 3 incisions which are used all over the world. The most common one, of course, is the one that comes under the breast crease. It's known as the inframammary incision. There is a small cut made over there, and then a pocket is made. Now the pocket is made either under the muscle, under the breast, or under the tissue which lies between the muscle and the breast. This decision on the pocket is something that we will make technically during consultation, primarily because we need to know what kind of patient. If she's a young woman and she's likely to later breastfeed, and then the breast may sag a little, and if we put in an implant under the muscle, that is going to look a little odd gradually as she gets older. The other thing is that if the breast tissue itself is not adequate, we really cannot be able to put in the implant under the breast itself. It has to be either under the fascia or again under the muscle. So this technical decision is something that we make only on consultation. Now this decision on the incision, the commonest, like I said, was the inframammary incision or the one under the breast crease. That does leave a small little scar. So there are some women who don't even want that scar. Now as plastic surgeons, we cannot do anything that does not leave a scar at all. But what we try to do is give you the best scar so that camouflage will be very well done. The junction between the areola and the normal skin is the one where, as it is, there is a change in the color. So an incision made in that junction usually leaves an excellent scar. Technically, this is a difficult surgery to do, but we do it over here. The other incision that is done is through the armpit or the axilla. Now that also will leave an excellent scar because there are as it is lines in the axilla, so it looks like one of the lines of the armpit. It leaves an excellent scar, but technically very difficult. There are limitations to the positioning of the implant as a result. I don't do that procedure at all. So this will more or less sum up the augmentation part of the implant part of the breast augmentation. The other technique that we do for breast augmentation is what is known as the fat transfer or the fat fill. Now what we need to understand is, it seems like a buy one get one free offer when there's a liposuction done and the fat is taken out of the abdomen or the inner thighs, and then those microlobules of fat is then transferred into the breast. But what tends to happen is that you cannot get that kind of global enhancement that you do with the implant. Large enhancements, large augmentation can never be done with just fat. So a woman coming in saying that she wants just a small amount of an enhancement done of a breast, or a breast to be slightly augmented, fat will work very well. Or for a woman who comes in saying that there are certain small areas in her breast which she feels are a little flat. Now she wants a slightly better cleavage, or she feels that there is another area which some surgery has been done previously and that looks a little flat, and she wants it rounded off and to look full and nice. Those are the areas where fat does very well. This fat transfer, or fat fill as we call it, lipofill as we call it, is something very exciting, and we have all been working towards it. Hopefully in the years to come there will be some kind of advancements in it, and that will come into be almost on par with the implants that we put in for breast augmentation for the patients. Now we'll get on to the next topic, which is the breast reduction. So who are the women who come in for breast reduction surgery? These are the ladies who have very, very obese breasts, primarily because they have put on a lot of fat, and as a result the breast also gets targeted, it becomes very heavy and it begins to sag. There is another group of women even soon after puberty, because of the hormonal overload, end up having very, very big breasts, again because they have some kind of a genetic preponderance as well. So the breast is not at all in proportion with the body frame. So for these people, they usually come in complaining, saying that they have severe neck pain, they have severe back pain, they have severe shoulder pain. Some of them can't sleep flat on their backs when they sleep at night because of the weight on the chest, and some of them even have these very, very ugly scars because of the welts of the bra straps. So these are all the reasons why patients come in, over and above, of course, the actual cosmetic reason where they're not able to wear clothes of their choice because their breasts are too big and they're constantly trying to hide the ugly big breasts. So for these women, we offer what is called a breast reduction surgery. Now, breast reduction surgery is one of the more major surgeries that we do on the breast. It takes much longer than the other surgeries. It is a lot more intricate in terms of the marking and the decision making. So the patient, we have to, because with this breast surgery, the idea, for all the breast surgeries for that matter, the idea is that when we operate, it should not be just an appearance that lasts for a year or two. We need to add in for the factors of aging, add in for the factors of hormonal changes, maybe child breastfeeding. So the breasts will sag. So we need to sort of counter all that and then take a plan as to how the breast is going to look maybe 5 years, maybe 10 years from now. So that is the decisions that we make during consultation. Once the decision is made about the breast reduction surgery and how much the nipple areola actually has to be lifted up. So we normally make it a little smaller and we definitely lift it up. So depending on that distance, then the decision is made as to which technique we are going to be following. A good amount of breast tissue is excised and removed. I personally have removed from between 500 grams in one breast to even 1500 grams in a breast in certain women. So this amount of breast tissue, when it is removed, does lead to a certain amount of blood loss. And these patients, we normally prefer to keep them in hospital overnight, because we can then monitor the blood loss and see whether the body will be able to manage it on its own, or whether we need to give a blood transfusion. So by the next day, when the patient is completely comfortable and able to manage on her own at home, we send her home. So this was the breast reduction surgery. The next one is what is called the breast lift. Now this is for women who have probably lost a lot of weight suddenly, very drastically, and the breast begins to sag. It's not that the breast becomes heavy, it's just that it looks very saggy. Or women, post they are having breastfed, find that their breasts have sagged very badly and it's not really in proportion with their youth. So they feel very embarrassed about the way the breasts look. So for these women, we do what is called a breast lift. In terms of the marking and in terms of the measurements, it is more or less similar to the breast reduction surgery, but there is not that much tissue which is cut. So it is more of a reorganization actually of the breast, which is done rather than actually cutting much of the breast tissue. But in spite of the fact that we have to reorganize, we definitely need to remove a little bit of breast tissue. So the breast does become a little smaller in size as compared to what it was earlier. So this is something that we were very clear about to the patients. So some of them asked if they can have an implant put in the same sitting, so that they can go home with a breast which is big enough, at the same time looking very aesthetic and youthful. So this is primarily what the diagrammatic picture is of what we do. So the nipple areola has been lifted up. You will have sutures around the nipple areola, which, as I have already mentioned, normally do very well because of the change in the color, that that junction sutures always settle very well over there. And then the two pillars of the breast are brought together. This happens both for breast reduction surgery as well as for breast lift, of course with less tissue removed for breast lift surgery. So the final scar will be one scar over here and one under the breast crease. That will be the final scarring both in your breast reduction surgeries as well as in your breast lift surgeries. So we now get back to the last topic, which is the axillary tail removal. Now axillary tail per se is the tail of the normal breast anatomically, which goes into the armpit. So this tends to hypertrophy in some women. Some women especially come in complaining that after they have fed their baby, when their breast has become bigger, this also had become bigger, the tail had also become bigger, and it did not involute as the breast involuted. It has just remained big. There is another element to it, which is the fat. So women who put on fat tend to put on fat even in this area under the armpit. Now this tends to look very ugly, and women are very conscious about it because they cannot wear sleeveless clothes. And even with the sari blouse or the salwar kameez, if one wants to wear a slightly tight fitting, it tends to look like a very ugly bulge in the way, and it tends to hurt because the tight seams put pressure on it, so it tends to hurt. So what we need to do is, and another reason why people used to come in earlier was because the minute they see a lump over there, they assume that it must be a cancer. So one thing you can be very sure about, that unless there is a lump growing within this lump per se is not a cancer. So we will operate on this only for cosmetic reasons, not really because this looks like a cancer or it is going to become a cancer. There is no preponderance for this to become a cancer of the breast. So this surgery is done when we address both the elements, the element of fat as well as the element of the breast tissue. So there are some people who will offer just a liposuction for this. What tends to happen is, by a liposuction, the fat element alone is addressed and that comes out. So instead of completely having a flat appearance over there, initially it will look flat, but gradually, because of the fibrous breast tissue which is bound to be part of it anatomically as it is over there, that will slowly begin to look a little ugly. So we do a slightly different procedure where we address both the points of both the elements of the axillary tail when we remove it completely. So I will now just quickly, this is what I had shown you earlier. This is what the axillary tail really looks like, the hypertrophic axillary tail. This is the ugly bulge that looks like. So you can imagine when the sari blouse or even the salwar kameez, the seam lies on it, it tends to put pressure on it and looks very ugly. So now I'm just quickly running through what you can expect when you come in for surgery once the decision has been taken for going in for surgery. So we will ask for all the routine investigations because all these surgeries are being done under general anesthesia. So the anesthetist gets to see you beforehand, and any wrinkles in the investigations, if something is not normal, all that will be ironed out before we take you up for the surgery. Routinely we ask for a mammogram or an ultrasound breast depending on how old the patient is and on the density of the breast. Why do we do this? Because primarily we are doctors. We would prefer to treat our patients holistically, and we need to make sure that there is no cyst or this infected cyst inside the breast before we are even operating on it, or probably a small little cancer which is being missed. All those things have to be completely clarified before we actually take you up for a cosmetic surgery. Now, we usually advise patients to stop all hormones, ideally for about a period of 2 weeks. We even look for about 6 weeks if you can, excellent, but 2 weeks definitely is a minimum period of time when contraceptive pills have to be stopped. Certain vitamins, especially those containing vitamin E, because that increases the capillary fragility, which means that to us when we are operating, there will be a little more bleeding on the table. So we would rather have all these medications which could produce problems post-operatively stopped. It also includes smoking. So a woman who smokes is asked to stop smoking for at least 2 weeks prior to surgery so that the wound healing will be as ideal as possible. Now the next one is the dress that we ask you to bring in. Post breast surgery, most of the patients will have certain restrictions that we will inflict upon them. So we ideally ask you to either have shirts to wear, so it will be completely front opening, or even a completely front opening button down dress. So that will have to be worn most probably for about 5 to 7 days post surgery once you get home also, so that you will be comfortable in it and it will be a lot easier for everyone concerned. Now, most of our surgeries are done under daycare, as I explained, except for the breast reduction surgeries where we ideally keep patients in for an overnight stay. So daycare means the patient comes in on an empty stomach in the morning on the day of surgery. Anesthetist would have already given all the ideas and the advice regarding the antihypertensive drugs, the thyroid drugs. Advice would have been given for the diabetic medication. So with all that, following all that, the patient comes in the morning for surgery and then will go home the same evening, having eaten something, having been mobilized by our staffs in the recovery room. They will then go home the same evening. Except, of course, like I mentioned, the breast reduction surgery patients who stay overnight and then go home the next day. Now, we do the marking of the breasts. Marking basically is one of the most important things in any of our cosmetic surgeries. It is the first step, most technically important step in any of our surgeries, and we do it either with the patient sitting or the patient standing in the recovery room or in the theatre. And this is something that you should not get anxious about, because there will be measurements being done. It will be like literally like a tailor shop where we'll be measuring with a measuring tape and marking it and then discussing and maybe changing a little bit. So instead of getting anxious about the entire thing, it will be nice if you can join in the conversation with us and understand what really we are doing. The most intricate of the markings, of course, are the markings that we do for the breast reduction surgery. Because it has to, like I said, all these surgeries have to last you not just for the coming 6 months or 1 year, but it has to last you for a lifetime. The post-surgery restrictions for each of these are more or less common. For the breast augmentation surgery, of course, there are slightly different restrictions. We do not allow the woman to lift her hand up, or her hands don't go to the back. At the same time, we don't allow her to lie on her sides. This goes on for about 48 hours till our first look dressing. And then for about 5 to 7 days, certain restrictions on the hand movement continue. Patients, most sutures are removed by about the 7th to 8th day, following which for another 2 weeks or so, still restrictions continue. Now, getting on with normal life is usually possible from about 4 weeks to 6 weeks post a breast augmentation surgery. Breast reduction surgery, again, there are a lot of stitches that are put in, because it's a very, very large incision. So the sutures that are put in are many. It takes time. We start suture removal from about the 7th day. It's about 3 or 4 times when you'll have to come in for the suture removal, up to around the 14th day sometimes, because we keep what we call the key point sutures in a little later. We remove those a little later to help in the breast wound healing, and this will go on. So for till about 14 days for sure, one will have to keep coming in and going to get the sutures removed. Following which, we have for another 2 weeks or so, we ideally tell patients that they should not try to get back to their normal work. They need to actually take a little time and then get back to absolutely normal. So around 4 weeks is the time that we are looking for. Now, the other restrictions for both the axillary tail removal is about 7 days to about 10 days that we restrict your movements. Ideally, even after 10 days, I would suggest for another 2 weeks that you don't try to go and take out the cobwebs and don't try to lift your baby from the ground. I suggest a minimum period of 2 weeks. Sometimes you may need to give it a little longer, because even though the wound has healed, there may be a little bit of pain, because after all, it is an inflammatory process and you are going through a surgery. So you would rather let nature take its course after that and let the healing happen completely normally. So 2 weeks is a minimum period of time. 3 to 4 weeks is extremely good. breast lift also will fall into the same sort of restrictions. Now, what are the complications of each of these surgeries? So the complications per se, I would say, are asymmetry of the breast, which I really cannot call a complication so much as what is basically something that even God has sent us down with. About 70% of the women have one breast bigger than the other, which is really surprising actually when you come to think of it. So we do make an attempt to give you complete symmetry, so both the breasts look equal in shape and size, but it may not always be possible, and this is something that we make very clear from the beginning. It will not be a very major difference, but yes, it can happen. Again, the nipple sensation, there are very rarely that the nipple necrosis happens. It has not happened for me, but nipple sensation definitely can come down post surgery, primarily because we do not cut the nerve that supplies the nipple, but it can get stretched in the course of the surgery. So when that happens, there may be a reduction in the sensation of the nipple, which gradually does tend to come back to normal. Wound healing is another thing that sometimes in some patients tend to get a little delayed, and in which case you may have a little bit of problems with the wound healing. So instead of healing within 7 days or 2 weeks, it may take sometimes up to 3 to 4 weeks, which is not a very major thing. At least I have never had any major wound healing problems. Most of it we teach you how to do the dressings at home, and then you just come back and show it to us and it settles on its own. So scarring, sometimes the scars, depending on your skin texture, the scars can be very thick and ugly. We do our best because our tissue healing, our tissue handling is about the most superior. As plastic surgeons, this is the one thing that we are taught. So our scars usually heal very well, but there may be some amount of scarring which you're not entirely happy about, which we will need then to take a relook at and then decide how best to do it. So this more or less covers a sort of, I could call it probably a bird's eye view of what the procedures of the cosmetic surgeries of the breast are. We will now move on to the next part, and I will just ask my secretary Kalpana if she can tell us the questions which have come in so far. And if you all have any questions which are not being answered, please keep them coming in because we are here to answer it. So Kalpana, can you first give me the first question?
Are implants safe? How long does an implant last? And can I feed my baby after implant surgery?
Okay, so are implants safe? Yes, that's a good question. Now what we need to understand is an implant is a foreign body. It is not your own tissue. So we are putting in a foreign body, and over the years there have been so much of technology and so much of research going into it to try and make it as safe as possible. So as on date, there is no problem with the implant, so to speak, in the sense that it is not an unsafe proposition. But yes, you need to be aware that you are putting in a foreign body into your tissue, and it does not really come, you said how long does it last? It doesn't really come with an expiry date. Implants do not come with an expiry date, but ideally we always advise you to go in for an implant for about 10 to 15 years. Up to 20 years is good. After that, it's always advisable to have it removed or to maybe have it changed and go in for a bigger size. But yes, 10 to 15 years, and the maximum would be around 20 years.
Can I feed my baby after implant
Right.
surgery?
So you can definitely feed your baby after implant surgery, because we are putting the implant in a plane where the breast tissue is not, the lobules and the ducts are not being cut. So the milk will definitely be there. It is safe for your baby. You can definitely feed your baby post having an implant. There is no issues with either that or following even breast reduction surgery. You can definitely feed your baby. Breastfeeding is not a contraindication.
What are the complications of implants? Can implants produce breast cancer?
Okay, so now the complications of implants per se, I didn't cover that in my talk. That's a good question anyway. So implants per se, so what can happen is, what we need to understand is implant surgery, whether it is a breast implant or whether it is the hip implant or the knee implant, is the holy grail of all surgeries. It needs to be done with complete asepsis. It needs to be done in a theatre where everybody is aware of the requirements of the surgery and the extra care that needs to be taken. So when we put in a breast implant, we have to be doubly certain that we are not going to create any infection and that there is not going to be any infection. We have never had any cases of infection in our implants in our center, but yes, it is a known complication. There can be infection, there can be a little bit of serous oozing coming out, which tends to happen when there is a minimal infection, when there's a minimal reaction to the implant, which starts that way. And then some step has to be taken. Either the implant has to be removed and given a little bit of a break, and then the implant again, maybe after a few months, is inserted again. This has been done by other practitioners. I have personally had no experience of it. The other thing is that the implant, being a foreign body, as I have told you, the body tends to cover it with what is called a capsule. So it forms a little tissue so that it localizes the implant. So in the olden days, when people did not understand that the implant is a very, very delicate thing and we need to handle the tissue very well, it was roughly put in. Even today, there are practitioners who have not trained but who insist on doing implant surgery, who put it in a very rough way where the hemostasis or where the blood, small little bit of blood leaking also can increase the inflammatory reaction, and the body can create a capsule which is far thicker. That ends up in what is known as a capsular contracture. So you have this thick tissue, scar tissue so to speak, inside the breast, sort of limiting the capsule completely. And as a result of this, the breast itself begins to get a little hard. This is what is known as capsular contracture. So we tend to ask our patients to do some amount of scar massage. They have to sleep on their in the prone position on their stomachs so that the implant moves around a little and this capsule that forms is gently broken. We also give them some anti-inflammatory medication like vitamin E. But the primary way of breaking and making sure that the capsular contracture doesn't happen is on the table. Technically, when we do it, when we do our tissue handling with exquisite care, and we are very, very careful about the tissue as we leave it behind without any ooze, without any bleeding, without any extra fluid. So that is how we overcome the complications of the implants.
How soon after
there was some other question you said, sorry.
Can implants produce breast cancer?
Now, implants have been categorically proven that it cannot produce a breast cancer. That is very definite. What can happen though is that after the implant is put in, that we cannot do an X-ray mammogram, primarily because that pressure on the implant could create problems. So we usually avoid X-ray mammograms and the patient is told about it. MRI mammograms now have come to stay, and the quality of the MRI mammograms are a lot better. In the early days, the issue was, and I suppose to a certain extent it is still there, that we are a little concerned that the shadow of the implant may cover an early breast cancer if it is beginning to form incidentally. So that is the only worry. But an implant definitely does not create a breast cancer. On the other hand, of late there has been a few studies coming in that in a minuscule number of patients who go in for what is known as a textured implant, and of a certain company and of a certain brand in that company, there have been some patients who have been coming out with what is known as an anaplastic large cell lymphoma. It's called a BIALCL. Now this is a tumor, a malignancy which comes, and when a patient comes back to us constantly complaining of persistent swelling or pain, we need to look at it again. Sometimes there is a sort of a fluid that is collecting around the implant, and the tissue around it then is turning into a lymphoma, lymphomatous tissue. So procedure and the surgery for this, once it is diagnosed, is to remove the implant and remove the capsule which nature will form, to completely remove the whole thing and to leave the breast alone. That is the treatment really for this. It happens in a very few patients, and we have now moved therefore from textured implants. We do not use textured implants, but yes, this is a liability. Rupture of the implant per se does not usually happen these days because we have these cohesive gels inside the silicone cover. So rupture is not a major problem like it used to be in the early days. Now these days the rupture, even if it does happen, it will have to happen unless there's such a major accident that that the chest itself has been very heavily damaged, or a very, very brisk contact sport. Those are the only two ways in which a rupture of the implant can happen. So that is not something that we really see very commonly. Tell me the next question.
How soon after implant surgery can I travel?
Okay. Now, implant surgery, as I have said, we tend to treat with a lot more caution, and it will depend now traveling by train, or if you're planning to travel by bus, or even the flight, the jerky, the movements. We want to be a little careful, and we would rather not have the implant, moving around too much inside that pocket. You want things to settle. So ideally, we tell you about 7 to 10 days to stay put in the city, and after 10 days, if you can safely travel, it will be good. There have been patients who have left soon after suture removal. We haven't had problems, but the best thing, ideal thing would be about 10 days once you are in the city and post-surgery.
Next one. What are high-profile implants? What would you suggest is the best implant aesthetically?
Okay, so now, like I have already said, cosmetic surgery is all about what you want, not what I want aesthetically. We do have, high-profile implants. So there are 3 profiles to the implants. What we mean by the profile is the level of projection. So the high profile implant is the one that will project the most, make the breast look the most projected. Whereas the median profile makes the breast look round and bigger generally, globally. And the lower profile is just to increase a little less. Again, it will be around, the breast will look a lot bigger, and it will be a little less than the medium profile. So what tends to happen is in India, like the marketing guys say, fastest moving. Yeah. So the fastest moving profile in India is the high profile breast implant, because our women would like to have a nice projection which looks good inside your clothes. Whereas if you look at the Western women, they are looking for a breast that looks very good in their swimwear and even otherwise. So they want just a big a breast that looks big enough all round. So they look for the medium profile of the implant. This is the decision of the implant that is taken by the patient themselves. What we do is we measure what is called the base diameter, and like I already told you, we give them sizes, so we have an idea of what really they are looking for. At the same time, having measured the base diameter and looking at the implants which are available, we then tell them what size we can probably do given the breast tissue and given the limitations that they have come in with on their own bodies. We give them the limitations and what we can do. In this way, the patient goes home most happy because they accept that what we have done for them is the best that they could have done. So this is what I would suggest, that you come in and after over maybe a couple of consultations, then we decide what is best implant for you aesthetically.
Is it safe to do breast lift with implant surgery?
Certainly. Now, breast lift when you are doing with implant surgery is going to add to a certain amount of the morbidity, in the sense that we are cutting, there is going to be a little more bleeding, there are going to be few more steps, the surgery is going to be longer, but it can definitely be done. Ideally, most people would prefer not to do it if they want to be safe, but by doing it and by putting in an implant along with the breast lift, the patient is happy because she goes home with a nice aesthetic breast. At the same time, the size is bigger than what she had earlier, and it was not very big to start off with, unlike the breast reduction as I have explained. It was small to start off with, and with just the breast lift alone it would have got a little smaller. This is why they opt for it, and yes, it is definitely safe to go ahead with it.
How much leave should I take for breast reduction? How soon can I start work from home after breast reduction surgery?
Okay, so now we're talking about what we're calling the new normal, I guess. So like I have said, 14 days is a minimum for the healing process. There are times when the wound healing can take about 3 to 4 weeks. So ideally, if you need to wear your bra and get out and wear your formal clothes and go into the office, I would say about a month is safe. Primarily because even if the wound has healed completely, you need to understand that those scars are a little immature, and especially the one that lies under the breast crease, which will tend to be pressed upon by the bra, it can produce a small amount of pain and maybe discomfort, and more than that, it can produce a thickening of the scar, which is something in the long run that you definitely don't want. So ideally about a month is good if you have to get back to work. If you're working from home and you don't necessarily have to wear, the tight formals like you would wear if you're going out to work, then I think if you're feeling better, within about 2 weeks time, you can definitely start working from home.
I am very afraid of the pain and have been told after augmentation the pain and heaviness is very severe. Is this true?
So pain is something that we tend to take very good care of. There are a lot of women who come in with a very low threshold for pain. But firstly, what we tend to do is we give adequate sedation and adequate pain relief soon after surgery. What we have found is within the first 48 hours, if the pain relief is adequate, after that the patient is home scot-free. They hardly even require, in fact some of our patients don't even come back because don't even take the pain relief, the anti-inflammatory tablets that we would have given them, by about the third or fourth day, saying that they had no pain. Now what they don't understand is pain is only one part of the inflammation. So we give it for a period of 5 days so that all the other inflammatory factors also come down. So pain is something you can rest assured with us that you will not feel very, very badly, and having told us that you have a lower threshold of pain, we will be a little extra careful and we will cover you adequately so that you don't have to complain about it. Now in terms of augmentation surgery, it is not pain so much as, yes, definitely it is heaviness, because you have not been used to having this weight on your chest, so to speak. So initially there is a lot of discomfort. There are women who suddenly get up with a start in the night because this heaviness of the breast implant is sort of putting pressure on them and they're not able to understand why that is happening. So these are things that you get used to in about a week's time, when you begin to realize that this is part of your body and this is part of your body right now. And of course the actual appearance of it makes you feel very happy. So you get used to it. So this discomfort can be there, the heaviness can be there. It is not very significant, but it is something that you need to get used to. And once you do, you don't even notice it.
If I come into India for a breast reduction surgery, how long do I have to stay?
Okay. Now, I truly hope that you're not planning to come in right now till we have at least, flattened the curve as far as our COVID-19 is concerned, because you're going to have to be here for a while, and we will have your quarantine and other things. So, given that, I'm assuming that we're talking about in normal times, which I hope we're going to come back to at some point in our lives. What we tend to do is, with our patients from overseas, the ones from the eastern countries are able to even get their investigations in. So either on WhatsApp or by mail, we tell them what investigations we need, the routine investigations from anesthesia. So they tend to get those investigations in, and it is sent across to us. We send it across to our anesthetists, and the anesthetists then tell them if anything needs to be done. For the ones who are coming in from Western countries, we have them come in here, and on the day that they reach, we get the investigations done. That day is spent in consultations. They meet the anesthetist the next day, and then we follow up with 2 days of the jet lag, sort of just relaxing. On the third day, we get them onto the operation table. Following that, we try to keep them here for a minimum period of 2 weeks, especially breast reduction. Like I have told you, there can be a little bit of problems with with the healing, wound healing. So you would like to stay here for a minimum of 2 weeks. So I would say if you plan on staying for probably about 3 weeks, it will be definitely safe. Not after surgery, I mean totally. If you plan on staying for about 3 weeks totally, once you come into India, you will be very safe, because if there are no problems, you can go back earlier. But in case there are a few problems, which you want little things which need to be wrinkled out, it's always easier if you're here within arm's length distance.
Can you tell how bad the scar after breast reduction surgery?
Okay, like I had shown you on that picture, you are going to be having scars. The scars are not going to be bad unless your own skin makes it a little thick, because there are certain tendencies of certain skins to make it a little thick. So you are going to be having problems if you have a scarring problem like a keloidal issue. Otherwise, the thing is, there are going to be scars, but they're not going to be very bad. That is one thing that you need to understand. Yes, Kalpana, are we done? Questions are over.
Ma'am, your thoughts on mastopexy?
Mastopexy is exactly what I was saying. The breast lift surgery, that is the one that I was talking about. That is mastopexy. The technical term for breast lift is mastopexy. Right. Are we done with the questions?
Yes,
Yeah,
ma'am.
sure. So I would just like you all to come in to us. I would like to say a big thank you to you all for having listened to us patiently for the last 1 hour. And please do keep your questions coming in, because we are here to answer all clarifications. And these are the numbers at which you can contact us. Please contact us. Online consultations, as I have said, are available. You can come in to us for consultations from wherever you are, and we will be very happy to attend to all your cosmetic surgery needs. Thank you.